Sales. What a nasty word that is in dentistry. There's a lot of discussion and debate about using the word sales in dentistry. But I can tell you that the difference between a traditional clinician and a more progressive dentist, the only difference most of the time is how they treatment plan their cases. If you're not treatment planning cases $25,000, $30,000 plus, it usually means that you're probably a little bit more on the traditional side. That's not to say that's a bad thing, but it's to let you know that maybe your clinical skills are just not at the level of some of these more progressive dentists that are doing some of the bigger cases. There's nothing wrong with being a traditional dentist, but also realize that the word sales is not necessarily a bad word in clinical dentistry. We, many times in clinical dentistry, need to provide the best to our patients. And what you will find is that the traditional dentists lack that clinical know-how and that clinical skill. So they hide a little bit more behind the word clinical dentistry as opposed to selling dentistry, where in fact, the dentists that are more on the progressive side are providing the best that dentistry has to offer. And yes, in many cases, that becomes a little bit more of an elective procedure. And the word sales and the sales process comes into the picture.